Hi everyone, welcome to the Hospital Medical Home Demonstration Conference. I am so glad that so many of you were able to make it, even with the weather that we've had. This is just really an exciting day. Everyone's finished their first year of the project. Just a couple of housekeeping details. If you haven't found the bathrooms yet, it's a little complicated. You're going to go out and take a left and go up to the second floor. Wanted to ask if people could turn off their cell phones as usual. And we'll have more housekeeping details a little bit later about the lunch and the poster session and that kind of stuff. But so let's get started. My name is Marietta Angelotti, and I lead the Hospital Medical Home project for the health department. I'm a family physician. 2 years ago, I was in private practice, providing what I thought was excellent care to my patients. I thought I was dedicated and compassionate and thorough, and I knew I was completely exhausted. So I was outraged when I got my first report card from an insurance company, because the insurance company told me that less than 75% of my patients were getting mammograms and pap smears and colon cancer screenings. I couldn't see how that could be true. My first thought was, who are the people on this list? They're not my patients. I've never even seen most of them. Well, I knew that the patients that I did see, 100% of them, I persuaded and coaxed and referred them, filled out long forms to get them to go to the specialists and the screenings that they needed. What I didn't know was what happened after they left the exam room. Did the referral form get lost? Did they make it to the appointment? Were they scared and would have needed a little more counseling? Did the report get lost on the way back to my office? Not that that ever happens, but. So I realized that if I didn't know what was going on with my patients after they left my exam room, there was no way that I could really manage their health care. But I didn't have time to be doing that, and I couldn't do it alone. So the practice that I was in became a NCQA Level 3 patient-centered medical home. And I started to learn some of the things that I had wished that I had learned when I was in residency about having to do that kind of management. There's a lot more that we need to do and need to teach residents to do when they come out of residency training nowadays to be able to provide health care. We need to learn about organization and leadership skills that will help us do that. So I'm very excited to be a part of this project. That is trying to do exactly that, trying to align those kinds of challenges and opportunities in primary care with what residents are going to see in reality when they come out of training. And at the same time, using these challenges and opportunities to make our residency training primary care clinics the best possible places for patients to receive their primary care. So we are all so pleased to see all of you here today to share and celebrate the important work you've been doing for the last year in primary care clinics and sites throughout the state. Our most important goals in this project are to match the experience of physicians in trainings to those realities that they will face when they come out of training to provide this best possible primary care. This promises to be an exciting day of learning and collaboration. I encourage everyone to reach out to your colleagues in other hospitals throughout the day and afterwards. In other words, network like crazy every opportunity that you get. There are many amazing projects out there that need to be shared, including your own. There are many individuals and organizations responsible for this large project and for the conference. I want to thank first the funder who made it possible, CMS, the Center for Medicaid and Medicare Services. They have been generous and supportive of this important work. Clearly, the heavy lifting has been from all the hospitals and residency programs for the work they are doing to improve the quality and safety in their hospitals and affiliated clinics. We have also been helped immeasurably through the efforts of the hospital associations, the Healthcare Association of New York and the Greater New York Hospital Association. We've also been helped with the Primary Care Development Corporation, IPRO, our public health colleagues in hospital-acquired infections and women's health, the Office of Mental Health, and the teams within the Office of Quality and Patient Safety and the Office of Health Insurance Programs and Medicaid. And last, Laura Graham, please stand up, Laura, who has been coordinating all of the DOH activities of the project over the last year and a 1.5 years. 1.5 years. And Erin Weaver, please stand up, who has been instrumental in organizing this conference.